Hello everyone. Welcome to HeInfo channel. My name is Daisy. As you know, hyperlipidemia is very common. 93 million American adults, age 20 and older, have a total cholesterol count above the recommended limit of 200 mg per deciliter. Hyperlipidemia, high cholesterol, that's not treated can allow plaque to collect inside of your body's blood vessels, atherosclerosis. This can bring on hyperlipidemia complications that include heart attack, stroke. In this video, let's find out Fluvastatin, a medicine used to treat high lipid blood levels. What is Fluvastatin? What kind of drug is Fluvastatin? Fluvastatin, sold under the brand name Lescol among others, is a statin medication. It is exactly an HMG-CoA reductase inhibitor, which is used together with diet to lower lipid levels and reduce the risk of cardiovascular events, including myocardial infarction and stroke. Based on the effect on LDL cholesterol, Fluvastatin is 12-fold less potent than atorvastatin and 46-fold less potent than rosuvastatin. Fluvastatin was first patented in 1982 and approved for medical use in 1994. What is Fluvastatin used for? Fluvastatin is indicated as an adjunct to dietary therapy to prevent cardiovascular events. As well, Fluvastatin can be used as a secondary prevention agent for coronary heart disease, CHD. This indication includes the reduction of risk of requiring coronary revascularization procedures, for reducing progression of coronary atherosclerosis in hypercholesterolemic patients with CHD, and for the treatment of primary hypercholesterolemia and mixed dyslipidemia. Who cannot use Fluvastatin? Fluvastatin is contraindicated in patients with documented hypersensitivity to any component of this medication, active liver disease or unexplained persistent elevations in serum transaminases. What are the side effects of taking Fluvastatin? Common Fluvastatin side effects may include muscle pain, headache, stomach pain, nausea, or indigestion. In rare cases, Fluvastatin can cause a condition that results in the breakdown of skeletal muscle tissue. This may lead to kidney failure. Call your doctor right away if you have unexplained muscle pain, tenderness, or weakness, especially if you also have fever, unusual tiredness, or dark-colored urine. Let's deeper in the detailed information of Fluvastatin. Pharmacodynamics. Fluvastatin, the first synthetically derived HMG-CoA reductase inhibitor, is a hydrophilic, acidic, antilipemic agent used to lower cholesterol and triglyceride levels associated with primary hypercholesterolemia and mixed dyslipidemia, Fredrickson types IIA and IIB, to slow the progression of coronary atherosclerosis in patients with CHD and as secondary prevention therapy in patients with CHD to reduce the risk of requiring coronary revascularization procedures. Although similar to levastatin, simvastatin, and pravastatin, Fluvastatin has a shorter half-life, no active metabolites, extensive protein binding, and minimal CSF penetration. Fluvastatin acts primarily in the liver. It is prepared as a racemate of 2 erythroenantiomers, of which the 3R, 5S enantiomer exerts the pharmacologic effect. How does Fluvastatin work? Fluvastatin selectively and competitively inhibits the hepatic enzyme hydroxymethyluteryl coenzyme A, HMG-CoA, reductase. HMG-CoA reductase is responsible for converting HMG-CoA to mevalonate, the rate-limiting step in cholesterol biosynthesis. Inhibition results in a decrease in hepatic cholesterol levels, which stimulates the synthesis of LDL receptors and increases hepatic uptake of LDL cholesterol. The end result is decreased levels of plasma total and LDL cholesterol. Half-life. The half-life of Fluvastatin is short, about 3 hours. What does Fluvastatin do for a person? For adults patients requiring a low-density lipoprotein cholesterol, LDL-C, reduction of 25% or greater. The recommended starting and target dose is 40 mg per day orally twice a day or 80 mg, extended-release tablet, orally once a day. For patients requiring an LDL-C reduction of less than 25%, 20 mg orally once a day. The maintenance dose of fluvastatin remains from 20 to 80 mg orally a day. Should fluvastatin be taken in the morning or night? You may take the extended-release tablet at any time of the day. You may take this medicine with or without food. Take the capsule at the same time every evening, or if you take it twice a day, take it in the morning and evening. You may take the extended-release tablet at any time of the day. Thank you for your listening. Don't forget to like, share, and subscribe for HeInfo channel if you like this video.